name?
Hi, my name's Diamond. I'm from the University of Southern Mississippi. I'm just going to be your student nurse today. So will you just identify your name and your date of birth, please?
Callie Douglas, 12/1997.
Okay, so today we're just going to be doing a cardiovascular, respiratory, musculoskeletal, and gastrointestinal assessment. It should only take 7 to 10 minutes. If you feel any pain or discomfort or have any questions during this entire procedure, we can just stop and you can just let me know. Okay? So first I'm going to go ahead and start with respiratory. So I'm going to go ahead and then I'm just inspecting for the bilateral rise and fall of her chest. And then I'm going to go ahead and just palpate, make sure I feel no lumps, masses, or lesions, and I do not. Have you had any problems breathing, shortness of breath?
No, ma'am.
Okay, so I'm going to go ahead and just auscultate her respiratory sounds. Okay. Just go ahead and breathe in through your mouth every time I place the stethoscope down. I'm just listening for any crackles, any wheezing. Okay. Okay. Now I'm going to go ahead and assess your respiratory from your back. So I'm just going to go ahead and go to the back. First, I'm just going to go ahead and inspect. I see no lumps, masses, lesions. Just going to palpate. Okay. I feel no tenderness. I'm just going to go ahead and inspect. So we're going to do the same thing. Every time I place a stethoscope down in your back, I'm going to go ahead and ask you to just do an inhale and an exhale through your mouth, please.
Okay.
Okay. Okay, so I don't hear any cracklings, no wheezing. Said you had no shortness of breath, so now I'm going to go ahead and move on to our cardiovascular assessment. So I'm just assessing your skin tone and your color. I see no signs of cyanosis. Her skin is warm. I'm going to check for her capillary refill, which is less than 30 seconds, so that's within normal range. Now I'm going to go ahead and assess for 3 of your pulses. So I'm going to do your brachial, your radial, and your popliteal.
Okay.
So first I'm going to assess for your brachial pulse. Okay. Now your radial. Okay. And then can I have you just scoot down to the edge of the bed just a little bit? Okay, I'm just going to do your popliteal. Okay. So all your pulses are bounding. I mean, not bounding. They are normal and brisk.
Okay.
Plus 2, so that's normal. I just want to scoot back the bed for me. So now I'm just going to go ahead and I'm going to just palpate your chest. Make sure I don't feel anything. Everything is normal. So I'm just going to go ahead and just auscultate now. Okay, and you can just breathe normally for this part of the assessment. And then I'm going to listen to your apical pulse for 1 minute. Okay. So I don't hear any abnormalities, no wishing or anything like that, indicating any stenosis, regurgitation. So I'm going to go ahead and just ask you to lie down on your left side for me, please. And I'm just, for this, I'm assessing for any murmurs in your S3 and S4 sounds. So for S3 and S4, I'm going to go ahead and just use the bell of my stethoscope. get you to go ahead and just lie on your back for me, please? So now we're going to go ahead and we're going to move on to our abdominal gastrointestinal assessment. I'm just going to ask you to lift your shirt up, please. So I'm just assessing our abdomen. I see no distension, no lasses, no lesions or masses. Have you had any gastrointestinal problems? No pain, tenderness? Okay, so I'm just going to go ahead. I'm going to start off with assessing or with auscultating all 4 of your quadrants. I'm going to listen to each quadrant for 5 minutes. I'm going to go ahead and go on my right lower quadrant. I'm just listening for the clicking sounds in each quadrant. Okay, so everything sounds normal. I'm hearing the clicking. Now I'm going to just go ahead and palpate. When was your last bowel movement, Ms. Douglas?
Yesterday.
And then how would you describe its color?
It was brown, but not too dark.
Now would you say it was formed, watery, soft, hard?
It was formed, but soft.
Okay, so that's normal. Now we're going to go ahead and just work on our musculoskeletal. So we're just going to do some range of motion exercises. If you feel any pain during this part of the assessment, just let me know. We will stop.
Okay.
Okay, so first I'm going to ask you to bend your knee all the way to your chest. Okay. And then have you had any joint pain or swelling?
I have not.
Okay, so now I'm just assessing for her knees, making sure there's no swelling or joint pain. And then assessing for her elbows and wrists. No swelling, no edema, inflammation. So I'm going to ask you to raise your arm up for me. Okay, I'm going to go ahead and do your next arm. Okay, and then look to your left. And then look to your right for me. And go ahead and just lift your shoulders up to your ears, up and down. Okay, so I'm going to ask you to just come sit down at the edge of the bed for me. Okay, and just get you to point your toes. Okay, and then now put your arms up like this. So pull towards you. Okay, now pull towards me. Do the same thing for your legs. Pull towards you. Okay, pull towards me. Push towards me. Okay, and now I'm gonna do one more part of your cardio assessment. I'm just gonna ask you to lean forward for me, please. This is I'm auscultating for any aortic or pulmonary murmurs. Okay, and then have you had any problems with your ADL? So like brushing your teeth, cooking, cleaning, getting dressed?
No, I do them all independently.
You do them independently? Do you use any assistive devices, like with walking canes, crutches? No? Okay, so I'm gonna go ahead and just ask if you would stand up and come over here for me, please. And then I'm gonna have you just walk to that chair and walk back. And I'm assessing for her posture, her gait, making sure that everything, she's walking correctly, no assistive devices, okay? Just go ahead and just have a nice seat for me, please. Okay, so everything that I've assessed is within your normal range. I'm gonna go ahead and just document all my findings and then send them to your primary care provider. Did you have any other questions for me today, Ms. Douglas?
I don't. Thank you so much.
Okay, I'm gonna just go ahead and wash my hands and you have a great day.
Thank you.